What's up, MOMnation? It is Real Estate Katie, and I am here with another amazing Live and Learn and another amazing entrepreneur mama that is in our group, Erica. Hello, Erica, and welcome.
Hi, thanks for having us.
Of course.
I guess us as a group.
Right? I mean, your business is you. It's you. And actually, let's jump right into that. Can you tell us just real quick a little bit about Elite Medical Beauty? Because it's always nice to hear this type of information that we're about to chat about from the professionals. And I know that you are. So tell us a little bit about it.
Yeah, so we have Elite Medical Beauty, and it's myself, my husband Nicholas, and our other provider Jillian. The two of them do all the injecting. They're both PAs. They have about 17, 18 combined years of injection experience, which is really important when you're trusting somebody to inject anything into your face or body.
Yeah.
Both of them have an extensive background in primary care, urgent care, and other areas like pain management, that type of thing. And so this topic today is great for us because, you know, both of them have an extensive knowledge of, you know, everything medicine. Nick has started weight loss clinics before, and so it's a topic that's been kind of talked about a lot lately. So came to kind of educate people on what it is, if you want to tell them what we're talking about.
Yeah, absolutely. And I'm excited about it because, like you said, I have been hearing this word, and tell me if I butcher it, but it's semaglutide. Is that how you say it?
Semaglutide. Yep.
Yay, Katie can read. And I've been hearing it everywhere. And I know that I've been seeing it on some posts with Elite Medical Beauty, and I'm just totally confused as to what this is, how it works, and all of that jazz. So I'm really excited to have you here to kind of jump right into that. So if you want to jump into what it is, first and foremost, I know that will help me out a bunch.
Yeah, absolutely. So semaglutide is essentially the generic version of Ozempic. So a lot of people kind of interchange the two, but it's a generic form of Ozempic. And Ozempic was started as a drug for diabetes. And what they realized in the clinical trials and thereafter with people taking the medication is the majority of the people that were on the medication were losing a fair amount of weight. So after years of it being out, they decided to rebrand it to Wegovy. And so Wegovy is the brand name of semaglutide. And if you were to go, say, to your physician or anywhere and get a prescription of either Ozempic or Wegovy, it's very, very, very expensive. So the compounding pharmacies have compounded it, and it is semaglutide is what the actual drug is, and they've compounded it, and now it's available in a generic form, semaglutide. And so essentially what it does is it controls insulin resistance, which is one of the reasons why a lot of people have trouble losing weight, is because they may be insulin resistant. But it also helps to delay gastric emptying. So it's going to give you that feeling of being full much sooner than if you weren't on it. So say you sit down to eat your dinner, and instead of eating the full plate, you might eat a third of that plate. So essentially you're eating a lot less, which helps you to lose weight.
So is it a pill? Is it an injection? How does this work?
It can be a pill or an injection. The injection is the best way for administration. So what we do is we do an injection form, and it's just a very easy injection. It's an insulin syringe, very, very tiny. I'm terrified of giving myself injections, and it was super simple for me after the first like jitters of the first one. It's like nothing. So with our patients, they get the bottle, they take it home, and then they do the injection themselves once a week.
And where? Does it matter where?
Yeah, most people do it in your stomach. You can also do it in your thigh. But the easiest that people see is usually in their stomach.
And is that the area that it's going to treat, or does it then go throughout the entire body?
No, it goes through the body. Yeah, and it's amazing how big of a difference such a small amount of medication will do. I was actually really surprised because the very first dose is only 10 units, which is only about like this much on the syringe. But that's what you start out with, and that tiny little bit of medication makes a huge difference. And then you do end up ramping up and titrating up over the next, however long you're on it. Every 4 weeks, you double your dose if necessary. But if it's working well on a lower dose for you, then our providers kind of work with each patient to determine what dose is going to be best for them.
Okay, yeah, that was my question, is how do you know?
Yeah, so everybody starts out at the same dose and then they bump up every 4 weeks. And then, say you start at 10 and then you bump up to 20 after 4 weeks. And if you bump up to 40 the next 4 weeks and that's working for you and you're seeing the weight loss that you'd like to see and your appetite has been suppressed, then usually what we do is we keep people on that 40-unit dose rather than continuing to step up and step up. Because if you do step up more and more, what can happen is you can lose weight too quickly, which is not something that's healthy.
Right.
But also it gets more expensive the higher dose that you're on. So if you do well at that lower dose, then we want to keep you at that lower dose because it saves you a little bit of money as well.
Yeah, that makes sense. So what is the typical experience? Say I were to do this, after a week, what are the typical results that I might see?
So when you start out at that lower dose, because the main reason for that is the most common side effect of this medication is nausea.
Okay.
So if you were to go right into a 40-unit dose without starting low, you would probably experience some severe nausea. So we start you out at a lower dose to get your body used to it. And as you go up, those symptoms are less. So not everybody has nausea with this medication, but that is the most common side effect. And it's usually very mild. And it's usually right when you start taking the medication or you increase your dose. And there are medications that we can prescribe that are very safe, such as Zofran, that help with the nausea and help you get through the couple of days of just feeling kind of icky. But then after that, and once your body gets used to it, then those symptoms kind of go away, or the side effects go away. And so you would start at that 10 units, you would do your shot every single week. And then when you bump up your dosage to that 20 units. What we do is we give you we give you the medication, we give you the supplies, we give you all of the dosage instructions and access to our providers at any time. And then you would do the shot yourself at home once a week. So makes it really easy. You don't have to go somewhere to get your shot every week, drive there, go in. And for most people, our clients are seeing about, in the initial doses, sometimes it's about a couple pounds a week, but when you get up to the higher doses, then we're seeing about 6 to 10 pounds a month.
And are there any suggestions for anything else that you should be doing at this time? Do you need to make diet changes? Do you need to start exercising? Anything like that?
Any successful diet is going to have some of those components in it. Obviously, I mean, if you do any diet and you are really hardcore with a diet for, a few months, and say you lose 30 pounds in a few months, and then you go back to what you were doing before, you are going to gain the weight back. So with the semaglutide, we do encourage everybody to kind of get on some healthier eating habits, start to exercise if possible, and then also start to kind of pay attention to the portion control portion of this. You are going to be eating a lot less than what you normally eat. So if you, and it's kind of not by choice, it's because you feel full, you have less cravings. So if you continue with those portions after you are done with the medication, then you're going to have much better success rate than if you were to just go back doing what you were doing before.
So how long is this, like a forever thing? Would I just do this forever? Or how long are people typically on this type of regimen where they're doing the once a week shot?
Every single person's different. So we, in our consultation, we discuss with each patient what their current weight is and what their goal weight is, and kind of give them an estimate of how long it might take for them to meet their goals. For some people, they say, it's been kind of a summer of vacationing and a winter of holidays eating. I need to lose, 10, 15 pounds to feel like myself again. For those people, they're probably only going to be on the medication for one vial, maybe a couple of months. For other people who have kind of had, more weight gain than that, maybe, 30, 40 plus pounds, it may take them, 4 or 6 months, possibly even a year. It really depends. The medication does kind of work differently with everybody.
Mhm.
When I started it, I was one of those people where I'm like, I've gained a few extra. I'd really like to kind of just slim up a little bit. And I lost 6 pounds in my first week on the medication, which
Wow.
is not necessarily recommended, but it worked really good for me right off the bat. And then for some people, they don't see more of that weight gain until they get into the higher doses. So it really is different for everybody. And there's not really a way that we can say, oh, this is going to work for you right off the bat, or it might take a little while, but it is 100% effective for everybody. And I mean, whether it be right in the beginning or after they get up to the higher doses. I mean, every single client that we have on this right now is losing weight and they're happy with their results. So it's it's one of those things. That's why everybody's talking about it. It's definitely revolutionized the weight loss arena.
Mhm.
Um, Nicholas, my husband, he has, opened up multiple medical clinics and then brought in weight loss components to these clinics because he started out years ago in pain management. And as we know, when people have a little bit more weight on them, they tend to, have more pain in their knees and their
Right.
back and all of that. So that was one of the things that he brought into the clinic, was kind of some weight management programs. But back then, all we had to do that with, that was, a prescription, was some of the stimulants like phentermine or fen type things. And those medications can make you feel very jittery. They can, they kind of ramp you up. And for a lot of those certain people, it's not good for, because it can affect your heart.
Yeah.
Nowadays, you have to have EKGs before any of that medication is prescribed by, a physician who is, a responsible physician would make people have EKGs. And the beauty of this medication, the semaglutide, is that there is no stimulant, so it's not something that is going to make you feel that way or have a negative impact on your heart. There are a couple of contraindications to the medication. One of them is pregnancy or nursing. And then the other one would be a medullary thyroid cancer or family history of it, which is pretty rare. But outside of those two, there's not a lot of contraindications for it. So pretty much anybody can take this medication safely, which is really nice.
Mhm.
Um, for people that don't have their gallbladder, it can create a little bit more gastrointestinal issues, tummy aches and stuff like that. But it's not something that would prevent them from taking it. We just make them aware that they may have a little bit more tummy upset with the medication than the average person. But it's been amazing because it really does change a lot of lives. It's working really well for people. We have clients that have been on it for a couple months to a few months who've lost 30, 40 pounds on it. I mean,
Wow.
it's really, it's life-changing for a lot of people, which is really, it's fun to see the progress.
Yeah, absolutely. I'm sure that's definitely warms your heart when somebody is excited about their appearance again and it's
Yeah.
working for them. So besides the potential nausea, Is there any other side effect that we should be aware of that affects most people or not a lot of people?
The only one I would say a couple of them that we have seen, heartburn can be a potential side effect. The reason for that is because it does delay the gastric emptying. Sometimes if you eat too close to bedtime and then you go lay down, you get a little bit of heartburn. So if you avoid eating too close to bed, then that usually, takes care of that. Or you can take common heartburn medications for that. And then I think, the other one that we don't see a ton because we really do educate our patients on the medication is just losing weight too quickly. This is, for a lot of people, they're like, yeah, I want to lose weight as fast as possible. And that's amazing for your waistline, but it's not good for your body. It's not good for your muscle mass. It's not good for your face. That there's a kind of a meme and joke out there called Ozempic face. And it's when people lose weight too quickly and they start to lose their face. You lose the fat pads in your cheeks and in the side of your face and start to look really gaunt. And so we don't want people to lose weight too quickly because it does. I mean, if you are wanting to make a life change by feeling better about yourself, how good are you going to feel when you look like a skeleton?
Yeah.
So yeah, that is a potential, negative consequence of doing it. But if you're stepping up when you're supposed to step up on the medication and losing weight gradually, then you do avoid a lot of that.
But if that were to happen, then you have some injectables for that, don't you?
We do. I actually had to do it myself because after I stopped nursing my youngest, I was like, that's it. I'm getting my body back. I'm getting everything back. And I did keto. And that was before semaglutide became popular. And so I did keto and I lost 20 pounds in a month and a half. And so when I talk about losing your face and looking like a skeleton, I have personal experience from it. So I did have to do some like cheek filler and some fillers to kind of get my face looking back to normal. So there are obviously some solutions for that. So if it happens, there are things that you can do to make yourself look more healthy again, but those are costly and not everybody has the budget to do fillers or wants to continue to have to do that forever either. So it's better to have long-term results than, that quick and easy fix. And also the longer that you're on it, the better choices that you're going to be making when you're off of it. It's
Right.
creating those habits that are going to last you longer than being on the medication too.
That's a good point. I think that's super important. All right. So the burning question that everybody has, Erica, what is the cost?
Yeah, so the cost can range depending on where you go. We've seen it be anywhere from, a couple $100 a month to $600 or $800 a month. It just really depends on the clinic. At our clinic, what we do is we prescribe it by the vial. So instead of doing, sorry for the noise out here.
Oh, it's okay.
I don't know if you
can
can hear that. Instead of doing a monthly amount to where you pay, say $300, $400 a month, and then you come in for your injections weekly, what we do is we charge $400 per vial. We thought that was a fair way to do it because when you start out at that low dose and you're doing 10 units for 4 weeks, 20 units for another 4 weeks, that first vial lasts you about 11 weeks. So if you're paying between, $200 and $400 a month for the medication, that first vial is going to cost you between $600 and $1,200. And so what we do is we just charge by the vial. So if you're on the lower doses and you want to stay on the lower doses because it's working for you, then you're still paying for the vial instead of paying way more than what you would pay, if that makes sense.
Yeah, absolutely. Thank you for breaking it down like that. Last question I have for you is how to choose a provider. What is important when somebody is looking into this and wants to do this? What is important about the connection they make with the provider?
So with anything that you do, it's really important to have somebody that's experienced in the industry.
Mhm.
I mean, just like you, Katie, I mean, somebody can hire a real estate agent that just started yesterday, and they're not going to have as much experience or know the things to look for as far as, houses go.
Mhm.
Um, and so choosing somebody that, has been practicing medicine for a while is important because, a lot of times we will recommend somebody to get labs before they do this medication. And, do you have a provider that is able to read the labs and see what's going on with your body and see if it's going to be a good option for you? I really like the fact that both of our providers have come from, a primary care background as well as a weight loss background, because they know that, if something is not working well for somebody, they can kind of tailor things to their needs rather than just a one size fits all option, which is really nice. But yeah, I mean, somebody that is, you have to be a provider in order to prescribe the medication, which is really nice.
Yeah.
So everybody that prescribes it has to have, some education on, what the medication does and how it works for different people. But just make sure that you're doing your research when you are choosing somebody. Make sure that they have the knowledge capable of handling whatever comes up.
I totally agree with that. So avoid back alley exchanges, guys. And I think that it's also important to consider price. And what I mean by that is the cheapest isn't always the best. And I know that, some people kind of have that mindset that they want the least expensive, option. And I don't know about you, but I've been living here for a very long time on this earth. And I have realized that the cheapest is not usually ever the best.
I turned 40 in a couple weeks, so I'm
Woohoo!
I'm right behind you. Didn't you just turn 40 recently? Couple
44.
44? Ah,
Yeah.
okay. Well, I've known you longer than that, so that seems like yesterday in my mind.
It's so true. It's
Well,
so
you look
true.
great for 44. You're
Well,
doing
thank
something right,
you.
Katie.
Thank you. And so do you. I mean, you don't look anywhere close to 40 at all. So great
Thank
job.
you. I have
What
a good injector.
Yes, you do. You do. And I also know that you take care of yourself and you err on the side of healthy as well. And so all of that makes a really big difference. If somebody would like to get in touch with you, maybe they are a little bit nervous, like you mentioned in the beginning, you got the needle jitters, right? I have the needle jitters too. You wouldn't know it because I'm tattooed, but I truly have the needle jitters. So I totally understand that. So if somebody has more questions, maybe that we didn't answer today, they want to talk a little bit further, they got the jitters, can they reach out to you? Is that okay?
Yeah, absolutely. Oh, and just FYI, I actually don't have a single tattoo because I have the needle jitters. You wouldn't know it, but I do. I am terrified of needles, but there's certain things that you'll do if you really want them. But what I can say is about the semaglutide, if anybody is having needle jitters over it, we do not have any pushback from people at all about giving themselves the injection because it is truly the smallest needle that you can't even feel it at all. So that first injection is probably the hardest, but then after that, you're like, oh my gosh, this is like so easy. I don't know what I was scared about. But yeah, as far as any questions or anything, absolutely. People are more than welcome to reach out to us. And what we always do before we do any procedure, whether it be Botox, fillers, anything, is we start everything out with a consultation. So
Good.
and it's a free consultation. So if anybody's interested in seeing if this is something that would be right for them, we do free consultations. The semaglutide ones are over the phone, and we just schedule those out and let you talk to a provider and see if it's something that would interest you. And they are able to schedule a consultation by calling or texting us. And I can give the number, which
Please
is
do.
480-382-9944 is our number to call or text anytime. And then we would just schedule the best time to chat with one of our providers.
Awesome.
And the consultation is about 10, 15 minutes for the initial consultation. So it's not something that
Nice.
you have to plan out a whole amount of time for.
Oh, good. So you can do it in the pickup line for, kids at school, because that's
Exactly.
where we spend a lot of our
Us
time.
moms, that's how we roll.
Yeah, exactly. Well, awesome. And I have your Facebook fan page also in the show notes. So that way it's easy and it's clickable for people to hop on over there, get all your contact
Yeah.
information as well.
Awesome. Well, thanks for having me, Katie. It's always a pleasure.
Always a pleasure. Thank you for being here. Thank you for clearing up the mystery of what semaglutide is. I appreciate that. If you guys want to check out the replay of this video with Erica, because she did deliver a lot of information. So hop on over to our YouTube channel. It is at MOMnation USA. That is our handle. If you are more of the podcast type, maybe you prefer to listen in your ears versus watch the video, maybe run a lot, bike a lot, do whatever, sit in the pickup line, because we're all moms and we do that. Then hop on over to your favorite podcast platform and do a quick search for MOMnation Talk Radio, and you will be able to download and be notified of all of our content, including our Live and Learn show. Thank you so much, Erica.
Thank you.
Bye, guys.
See ya. Bye.